So what needs exactly to be investigated though? Because isn't it pretty clear cut, person went to Mexico, came back? I mean, is Mexico not being looked at? Like, I'm just kind of clarifying.
Well, certainly we're taking that epidemiological data. We're taking the fact that travel history is a concern and may have impacted 3 of these 5 cases. What I'm trying to make clear here is that we now know that we have probable cases throughout the state of Wisconsin. And our follow-up is on contacts that and that may have presented concerns to any part of our community, and we want to make certain that whether you went to Mexico, whether you know someone who went to Mexico, if you are exhibiting those symptoms consistent with swine flu, you need to stay at home from work and contact your provider. So that's all part of our investigations, but that is not where our investigation starts or ends.
So then are either of the 2 cases in Milwaukee included in the 3 that?
That information is not germane to our message at this time. It's part of our investigation. The message here is that we want the public to take the precautions necessary to curb the spread of disease. We are getting that data, and we will provide more of it as it becomes necessary, but it does not change the message that I'm delivering today.
Doesn't it help the public to know that maybe these people went to Mexico and came back rather than it coming from?
Again, the state has implicated 3 of the 5 cases to be consistent with travel history, and that information has been shared. We know that maybe 2 of them are not, and we know that there may be others that may be implicated. Our investigation is rapidly unfolding. I don't have any other data at this time.
As you try to track this outbreak, how important is it to determine the date of onset for this, and have you been able to determine or pinpoint the exact date these 2 probable cases came to light? When did they actually become infected?
Well, certainly I'm going to defer to Dr. Swine on part of that question, but I'll say that part of our epidemiological investigation takes that very question at heart as we look at date of onset, and we look at when individuals actually present with concerns that they reach a healthcare professional. But I'll have Dr. Swine just drill down a little bit on that.
Hi, I'm Dr. Swine, Medical Director of the Health Department. So the date of onset for any case, not just the first case or the second case, but any case is very important because it helps determine the length of potential contagiousness. And that's very important in terms of identifying who the person might have been in contact with, who might be at risk, who we need to monitor. So dates of onset are very important indeed, but no, it doesn't matter which one particular date of onset, because we have to find out the date of onset for every probable case that we're doing.
Well, let's start with the first case here in Milwaukee. Do we know when that person contracted?
We do know, but I don't know it off the top of my head. I've got a lot of dates running around my head. I don't want to guess at it.
With respect to the case in Adams County, officials there released some non-identifying information about the patient, the gender, the age, that sort of stuff. Why are you not releasing that about the Milwaukee cases?
Once again, I mentioned that there's certain information that's protected under the Privacy Act, and we honor that. We certainly know that our colleagues are responding to this outbreak the same way that we are, and they're providing information as they see fit. The policy of the Milwaukee Health Department has been to honor the rights of protected information and to provide what data that would be germane to updating the public of the concerns surrounding swine flu. We don't believe that the gender or any other identifying information changes the scope of our investigation or the information that we provide to the public to protect themselves.
Wouldn't it be of some benefit, though, to the public to say whether or not this person's improving? And you talked about how you don't want people to panic, you don't want people to get excited, people are ratcheting up their fear. Wouldn't it be nice to at least know that they're improving?
I certainly agree with that assessment. And if I felt, and I think if the healthcare providers felt we could do that, but there are federal laws here that protect the privacy of the individual. So that's one overriding factor, that we're not going to stand here, we're not going to violate federal law in terms of privacy. The second concern, and I think all of us could realize this, and let's just use the youngster as an example. You can imagine how his mother or father or parents or caregivers would feel if they've got a sick child and all of a sudden there are 6 television cameras at their front door. We want to respect their privacy, but it can be a difficult time for them as well.
Can you talk about group gatherings? There seems to be some confusion. Some people are canceling Cinco de Mayo celebrations, yet the march is still going on tomorrow. What do you want people to do?
Once again, we have no recommendations at this time regarding the cancellation of large social gatherings. We believe that the community and those who organize these large gatherings are receiving the same information that you and I are, and they can make the best case for their private venues. There is no guidance from the Centers for Disease Control or from the state of Wisconsin that would suggest that the canceling of any large social gathering is warranted at this time. It has not been done by any local public health department, of my knowledge, across the nation. But individual organizations are making those decisions on their own. And while that may be prudent, there's no scientific or medical or public health evidence to suggest that we need to close or shut down large gatherings or social venues at this time. So we are understanding that individuals are making these decisions, but there's no recommendations from our local public health department or any that we've seen across the nation to cancel large-scale public gatherings at this time.
Are you seeing people coming to hospital emergency rooms trying to get checked on? Is that the way to go about it, or what should people do if they?
Well, certainly what we want to do, if someone is exhibiting symptoms consistent with swine flu, we would like them to call their healthcare provider, and then their healthcare provider will assess that call and then make arrangements before individuals show up, either in a clinic or a hospital, or emergency department, or any other healthcare provider's office, so that they can take the necessary precautions to curb disease in our community. That is the guidance that we've issued, and that's the hopeful guidance that we hope that individuals within Milwaukee will follow.
Commissioner, how many people from the city of Milwaukee or city of Milwaukee cases are at the state lab of hygiene right now being tested? Do you know?
Certainly we know that the state lab of hygiene has a large queue of samples that they are screening because some of those samples are forwarded directly to the state lab of hygiene from clinical providers. I don't have data on actually what that number is, but we're in close contact when it involves a specimen from a city of Milwaukee resident, and we have daily conversations, but I don't have the data on how many samples they currently have.
And we understand the CDC is putting together reagent kits that will allow places like the State Lab of Hygiene to test for swine flu. We understand those kits should be arriving shortly. Will the City of Milwaukee lab get one of those kits, and will you be able to test for swine flu?
The answer to both of those is yes. We will be receiving those reagents. They may already actually be on the ground here, and our laboratory will have the capacity to validate those assays, and we will have the capacity to do exactly what the State Lab of Hygiene is, and that is to identify swine flu and to pass that on to the CDC for final confirmation. We're pleased that those reagents have been made available under an order from the FDA to make them available to local public health labs. Our lab has the capacity. We've been around for a very long time, and we will assist the public in meeting the demand for samples as they get to our reference laboratory.
Do you expect that the State Lab of Hygiene will ask you to come in and help them take cases from perhaps this area of the state to relieve some of their testing that's going on?
We're in daily communication with the State Lab of Hygiene. We currently are backups to each other. When we're overloaded, they take our excess, and when they're overloaded, we work with them. So this is an ongoing, very fluid situation. We'll be in daily discussions with them regarding lives.
And that's one of the values of the governor's order, is it allows communities to help each other in times of need. So if we have the capacity to do it, and there are other communities who need help, we can be called to help. And if we need the assistance of other communities, we can ask them for their assistance as well.
Thank you very much.
Thank you all very, very much.
May I